Hello, I'm Cheryl Attkisson. Welcome to Full Measure. This cold and flu season, the Centers for Disease Control issued a new health alert about a mysterious virus responsible for nightmare scenarios. A child wakes up and his legs don't move, or he doesn't wake up at all. Enterovirus D68 hit the U.S. with a vengeance last year, mimicking one of the world's most feared illnesses, polio. And the medical mysteries of where it came from and why have yet to be unraveled. The mystery virus hit Seabrook, New Hampshire last year, disguised as a simple cold infecting teenager Dan Dugan. His father, Patrick.
We had taken him to his pediatrician a few times over the course of a couple of weeks, but they said, oh no, it's just a bug, it's going around, don't worry about it.
But it was something much worse. Dan woke up in the middle of the night, paralyzed.
I woke up and I waited until someone was awake.
And what'd you tell him?
That I can't move my legs.
Dan's parents rushed him to Tufts Medical Center in Boston. He was hospitalized for the next 49 days.
Do you remember how they told it to you or what they said?
They didn't expect him to ever walk again. They didn't expect him to have the use of his legs again. And that was, we were just destroyed. You know, we were devastated when we heard that, but they were more concerned like that he wouldn't even be able to breathe on his own when they were telling us this.
Alarming reports surfaced around the country. Respiratory illnesses so severe, many children ended up on mechanical ventilators. Some lost use of their limbs. Colin Lopez, an athletic teen in Oregon, suddenly paralyzed. Another child, Mackenzie Anderson, paralyzed from the neck down. Doctors say the patients had one thing in common, a virus called enterovirus D68, or EVD68, the dark circles in this microscopic image.
When they found out that everybody was having this enterovirus, then people got together and tried to figure out why this happened.
Dr. Scott Schroeder is a pediatric specialist at Tufts Floating Hospital for Children, where Dan was admitted. He says EVD68 is in the same family as one of the most feared viruses, polio.
It's of the same family, but the polio is like the black sheep of the family, and the enterovirus is just the nasty cousin that, you know, doesn't do what it should do.
It was the similarities to polio that chilled scientists to the bone. At its worst, polio killed 3,000 and paralyzed 21,000 Americans in a single year back in 1952. Now, 35 years after polio was eradicated in the U.S., doctors urgently sought to learn why a distant cousin had reared its ugly head in such a toxic form. In September of 2014, the CDC issued an alert.
So far, no deaths attributed to EVD68 infection have been documented.
Almost unheard of in the U.S. until now, but seen in Europe, Asia, and Central America, had people carried EVD68 into the U.S. from other countries. If the CDC had answers, it wasn't saying. The government watchdog group Judicial Watch was among those filing a Freedom of Information request to try to get more information from the CDC. Judicial Watch Director of Investigations Chris Farrell says his group is still waiting for a response from CDC more than a year later.
It's extraordinary. There's usually some effort to produce something, but in this case, silence from the part of the government. There's no accountability. There's no explanation to the public with respect to a public health crisis and the outbreak. And that is a disconnect. It doesn't make sense.
CDC's September 2014 statement was the last time it would address the outbreak on camera, yet things were about to get much worse.
Eli say, crocodile.
5 days later, Eli Waller, seen in this home video with his triplet sisters, became the first to die.
It was a bolt out of the blue. I mean, that's really what it was.
Andy Waller of Hamilton, New Jersey, said his 4-year-old son Eli seemed perfectly fine when he went to bed, but he never woke up.
There really wasn't anything, that would indicate that he was susceptible to anything like this.
Said, you want to try this?
Though EVD68 can be spread with a cough or sneeze, his sisters were unscathed. It all raised more questions than it answered, and the Wallers found facts hard to come by.
We were just running around, going from doctor to lab to next doctor to here and there, and we didn't have a handle of what was going on. It's like a thing that's out in the world. So that was the extent, really, of the information that we got.
After Eli, others lost their lives. Madeline Reed, a toddler in Michigan. Emily Otrondo, a 10-year-old in Rhode Island. The outbreak that CDC wasn't anxious to talk about on camera was far more pervasive and deadly than one getting lots of attention, the measles at Disneyland.
Bottom line on measles, it can be a serious disease.
By way of comparison, the Disneyland measles affected 143 people in 8 states with no deaths. EVD68 seriously sickened more than 1,200 children in every state. 120 were paralyzed and 14 died.
You don't want to see anybody, anything like this ever happen to anyone.
Eli's favorite dog in Paw Patrol.
Today, Eli is missed. His family tries to keep grief at bay.
And early on, we really determined, if things can happen like that, we just got to make the most out of every little moment that we get with them.
I tickle you every day.
As for Dan, his left leg remains partially paralyzed and other limbs are weak, but he's defied predictions, going from wheelchair to walker to this. He's even managed enough balance to get back out on the family fishing boat.
I caught almost a 500-pound tuna. I steered the boat while my dad veered it in.
He loves to be on the boat. And he ran the boat while we fought the fish and harpooned it, and he was so excited about that.
This season, the CDC is reporting sporadic paralysis cases, but won't say how many and won't talk to us on camera about the mystery disease. And frontline researchers are still looking for answers.
Why is it that some children get so sick and some even die from it?
That is the million-dollar question, is why some people get something, why some people don't. That's the thing that keeps me up at night, is how can we separate and determine who are the ones who are going to be more susceptible.
The CDC recently told me it would be at least 9 months more before it would be able to reply to my first of 2 Freedom of Information requests about this filed a year ago, even though the law requires a response in 20 days. Sadly, while everyone hoped the paralysis in the affected kids would be temporary, the latest studies indicate most of the children have minimal to no improvement. Only 2 of the 120 have recovered. Ahead on Full Measure, the flight for thousands of young men to join ISIS in Syria and the incredible journey of one Western father to bring some of them back.